Welcome to vpod.ai. I'm your host, Mike, and sitting across from me today to help navigate today's exploration is our resident expert, Susan. You can sponsor this podcast for just $25. Your message will be featured across major platforms like Apple Podcasts, Amazon Music, Spotify, and more. If you're interested, visit vpod.ai to get started today. So, to kick things off, imagine your brain is like a house equipped with the world's most sensitive, notoriously glitchy security system.
Oh, that is such a painfully accurate way to put it.
Right, like the wind blows against a window and suddenly the alarm blares, or, I don't know, a shadow passes over the porch, the sirens go off, the doors lock, and the power just entirely shuts down.
And you're just trapped inside.
Exactly. And that is exactly what a migraine feels like. If you suffer from them, you know firsthand it's not just a bad headache. It is this all-consuming, lights out, put your whole life on pause neurological event.
It really is. It takes over everything.
It does. And when you are lying there in the dark, desperate for relief, looking up natural remedies online is, frankly, an absolute nightmare.
Oh, the amount of misinformation out there is staggering.
It's so overwhelming. There is so much noise, so many conflicting claims, and just a whole lot of snake oil. So the mission for today's discussion is to just cut right through that noise. For you listening right now, we are looking directly at the clinical data behind 4 specific non-drug methods to relieve or prevent migraines. We want to make sure you are well-informed, armed with actual facts, and totally ready for your next doctor's visit.
Yeah, and that doctor's visit really is the foundational piece of this entire discussion today. It's crucial to establish right out of the gate that natural does not mean innocuous.
Right. That's a huge misconception.
It's massive because even everyday items, things sitting in your kitchen or your bathroom cabinet right now, they have actual biological effects. So every single method we discuss today needs to be brought to your healthcare provider to ensure it fits safely into your personal overall treatment plan.
Absolutely. The goal here is to build a well-informed toolkit for you to use, not to, play doctor yourself. So let's open that toolkit and look at the most immediate, accessible remedy we have. When that faulty security system first trips, what is the absolute fastest way to send a stand-down signal to the brain?
Well, interestingly enough, the data points to scent.
Right.
Specifically, lavender essential oil.
Which, honestly, it seems totally counterintuitive at first glance, doesn't it? Because migraines typically involve this severe sensory overload.
Oh, absolutely. You become incredibly sensitive to light, to sound, and to smell.
Yeah, the smells are the worst.
Yeah.
So utilizing a really potent scent to counter a condition that makes you hypersensitive to your environment, that is a bold approach.
It is bold, but to understand why that might actually happen, we have to look at the biology of scent. Because the olfactory system is very unique.
How so?
Well, unlike sight or touch, which have to be routed through a sort of a switchboard in the brain before being processed, your olfactory nerve has a direct, unfiltered line to the limbic system.
Okay, wait, the limbic system, that's the emotional center, right?
Exactly. It's the brain's emotional and pain processing center. So the molecules in lavender, they bypass the blood-brain barrier almost instantly.
Wow, instantly.
Yeah. So you are theoretically using scent as this rapid deployment chemical messenger to basically tell the nervous system to stop panicking.
Okay, let's unpack this, because the data on this is honestly a complete roller coaster.
It really is.
We have these older studies showing that just inhaling lavender essential oil in the very early stages of a migraine attack actually helped reduce the pain. And the participants in that one, they were simply rubbing 2 to 3 drops of the oil right onto their upper lip.
Right, highly localized and very immediate.
Exactly. And then there's another study from 2016 that went even further, finding that using lavender essential oil for 3 months reduced both the frequency and the severity of the migraines.
Which sounds incredibly promising.
It does. But here comes the catch. Fast forward to this massive 2024 systematic review and meta-analysis. They gathered this huge range of studies and concluded that there is actually insufficient evidence that essential oils significantly prevent migraines or reduce their severity.
Yeah, that was a big turning point in the literature.
So if the 2024 data says the evidence just isn't there, I have to ask, is this entirely a placebo effect? Like, are we just playing soothing background music while the house burns down, pretending it's actually helping putting out the fire.
That contradiction is one of the most frustrating things about reading medical literature, I will give you that. But it actually highlights how scientific research evolves over time.
What do you mean?
Well, when we look at those older studies, the ones showing people rubbing drops on their lip, we're usually looking at much smaller sample sizes. For those specific individuals in that room, the relief was very real.
Right. They weren't lying about feeling better.
Exactly. But a systematic review and meta-analysis, like the massive one in 2024, operates by entirely different rules. It scoops up all the available studies and applies these incredibly strict criteria.
Like checking their homework.
Exactly like that. If a study was too small, if the control group wasn't totally perfect, or if the methodology had even a slight flaw, the meta-analysis dilutes its impact. It is looking for an ironclad statistical consensus across thousands of people.
I see. So it essentially throws out the smaller, less rigorous data to find the absolute, undeniable truth.
In a sense, yes. But this raises an important question for you, the listener, sitting at home feeling a migraine coming on. Does the lack of a statistically significant medical consensus mean the lavender is totally useless?
I mean, I would think so, based on that 2024 study.
Not necessarily. The 2024 data tells us it is not a medical silver bullet. However, the risk profile of smelling an essential oil is incredibly low.
That makes sense. It's just a smell.
Right. If your doctor clears it, and rubbing a few drops on your upper lip utilizes that olfactory pathway to bring you even a fraction of comfort, even if it's just the calming psychological effect of, taking an action, it remains a viable supplementary tool.
Okay, so it might not put out the neurological fire, but it can help keep you calm while you wait for the fire department to arrive.
That is a very fair way to frame it. But, as we know, soothing the senses only goes so far. Eventually, we have to look at how a migraine travels through the body itself.
Because it rarely stays confined to just the head.
Exactly. It heavily impacts the digestive system, which brings us to our second remedy. We really need to talk about the nausea.
Oh man, for a lot of people, the stomach issues are arguably the worst part of the entire ordeal.
Absolutely debilitating.
The nausea just completely incapacitates you. You can't take your normal medication, you can't eat, you definitely can't function. And the data here points us towards something that might just be sitting in your pantry right now, ginger. Or, ginger tea.
Yes. The literature on ginger is actually surprisingly robust and gets quite deep into internal chemistry.
Really? Just ginger?
Just ginger. An analysis of clinical studies found that taking ginger extracts or supplements when actively experiencing a migraine can actually reduce both the pain and the nausea simultaneously.
Okay, I do want to push back on this a little bit, specifically regarding the ginger tea recommendation that pops up in the literature. It's often suggested as a way to take in ginger and, stay hydrated at the same time.
Right, which is important.
But we know dehydration is a massive trigger for headaches. So if someone is sipping ginger tea and feels better, how much of that is the ginger actually doing the heavy lifting, and how much is just the simple fact that they're finally rehydrating their body?
That's a vital distinction to make, honestly. Hydration is undeniably crucial. The literature even suggests other teas might be helpful simply because liquid intake is so vital during an attack.
Right. Any liquid helps.
But here's the thing. The clinical data zeroes in specifically on ginger extracts and supplements as the mechanism reducing the pain and nausea.
Oh, I see. Which means if you take the water completely out of the equation and just swallow a dry, concentrated capsule, it still yields a result.
It does, and that proves the ginger root itself has active properties functioning totally independently of the hydration.
Wow.
Think about what is happening in the gut during a migraine. Your digestive tract is essentially freezing up. It's a process called gastric stasis.
Like it just hits the pause button.
Exactly. It just stops moving. But ginger contains these compounds called gingerols and show gels. And what's fascinating here is that these act on serotonin receptors in the digestive tract, essentially forcing the stomach to start emptying properly again.
And that blocks the nausea.
Yes, it blocks the signals that cause the sensation of nausea. Furthermore, those same compounds have anti-inflammatory property that can actually help disrupt the pain pathways traveling back up to the brain.
That is wild. Ginger seems like the multitasking superhero of the pantry, fighting the headache on one front and the stomachache on the entirely other front.
It really is.
So when you sip the tea, you are getting a 2-for-1 deal. You get the biological mechanism of the root restarting your digestive tract, plus the essential rehydration the body desperately needs.
It's a synergistic effect for sure. But again, just to echo our ground rules here, even with something as seemingly innocent as tea, The information strongly stresses checking with a healthcare provider first.
Even for ginger.
Yes, because high doses of ginger can interact with blood thinners and other medications.
Good to know. Okay, so ginger handles the internal chemistry. But what if your nausea is so severe you literally can't even keep tea or a supplement down?
Mm.
Or what if the smell of lavender is just making the sensory overload so much worse?
That happens quite a bit, unfortunately.
Right, so if we can't use ingestion and we can't use inhalation, we have to look entirely outside those systems. We need a physical interrupt. And that brings us to acupressure.
Acupressure is such an empowering concept because it relies on the body's own mechanics. It involves applying firm physical pressure to specific anatomical points like, the webbing between your thumb and your index finger, or specific spots on the inside of the wrist to manage nausea and pain.
But the data here gives us another timeline contradiction, much like we saw with the lavender.
It does get a bit murky.
Yeah, because a 2018 review of studies on acupressure for primary headache disorders found preliminary evidence that it might help reduce the frequency, the severity, and the duration of the attacks.
Which is fantastic.
That's the holy trinity right there. Fewer migraines, less pain, shorter duration.
Yes, that was the initial takeaway from that 2018 data.
But then we fast forward to a newer analysis from 2022. And this newer analysis found that while acupressure may help reduce the number of migraine days a person experiences, it does not actually reduce the duration of the attacks themselves once they start.
Right, the attack still runs its course.
So based on the 2022 analysis, acupressure is basically like turning down the number of times the fire alarm goes off during the week, but once it starts ringing, you still can't turn it off any faster.
That is a fantastic analogy.
Wait, but if the 2022 data says it doesn't actually stop the migraine faster once it starts, why would anyone sit there pressing intensely on their wrist while in pure agony? Isn't that just incredibly frustrating?
It sounds frustrating, absolutely, until you look at the mechanism of what acupressure is actually attempting to do. It operates on something called the gate control theory of pain.
Gate control theory, what's that?
Imagine your spinal cord has a series of neurological gates. When you are experiencing a migraine, the pain signals are just flooding through those gates straight up to the brain.
Okay, I'm picturing it.
But non-painful physical touch, like applying firm pressure on a specific nerve pathway, travels along different, much faster nerve fibers.
Oh, so by applying pressure, you are sending a faster, non-painful signal to race ahead and essentially shut the gate before the slower pain signal can get through.
That is exactly the theory behind it. It's the same reason your instinct is to vigorously rub your knee right after you bump it on a coffee table.
Oh, wow, I never thought of that. That's so true.
You are trying to flood the local nerves with touch signals to literally block the pain signals from registering. What the 2022 data suggests is that regularly performing this practice might help calm the nervous system overall, making your baseline threshold for a migraine much higher.
Hence, fewer migraine days overall.
Exactly. But once that massive neurological storm is fully underway, applying pressure to your wrist just isn't enough to shut down the whole system. As you said, it prevents the alarm from tripping as often, but once it's ringing, you can't manually turn it off any faster.
Okay, but why is it that something like acupressure, which has been practiced for literally centuries, still only has preliminary evidence and this constant call for more high-quality research?
It really comes down to the inherent difficulty of standardizing human touch in a clinical setting.
Oh, because everyone does it differently.
Precisely. If we want to test a new pill, we give 500 people the exact same chemical compound and 500 people an identical-looking sugar pill. It is completely uniform.
Right.
But with acupressure, you are relying on different human practitioners or even the patients doing it themselves. They're applying slightly different amounts of physical pressure to slightly different anatomical locations on bodies of vastly varying sizes.
You can't put acupressure in a blister pack and control the dosage.
You really can't. Because of that total lack of standardization, the broader medical community rightfully hesitates to declare it a definitive treatment.
That makes total sense.
However, the lack of standardization in a clinical trial doesn't mean it lacks value in your living room. The empowerment acupressure offers a patient is significant. It is non-invasive, it requires zero equipment, and you can learn the pressure points yourself to take active physical control over your body's response.
And even if it merely reduces the number of days the fire alarm goes off, that is a profound improvement in quality of life.
It truly is, and it's absolutely worth discussing with a specialist.
I completely see the value in that. Taking any kind of agency back from a condition that just strips you of it is powerful.
Hmm.
But, all of these methods so far, the lavender, the ginger, the physical pressure, they are mostly reactive.
Sure.
You feel the symptoms and you deploy a countermeasure. What if we look deeper? What if the wiring of the security system is faulty to begin with because it's missing a key component?
Now we are moving from symptom management to foundational neurology. We have to talk about magnesium.
Yes. Here's where it gets really interesting. Magnesium is just a mineral, but the literature paints it as absolutely vital. It handles nerve signaling, it regulates blood pressure, it even regulates your heart rhythm. If the human body has an electrical grid, magnesium is the grid manager.
It is the ultimate regulator, and what the clinical data shows is that a deficiency in magnesium may actually have a direct causative role in producing migraines.
Wait, so how does a missing mineral actually cause the migraine? Like what is physically happening in the brain?
Well, at the cellular level, magnesium acts as like a bouncer at a very exclusive nightclub.
Okay, I love this.
It sits inside a specific receptor in the brain called the NMDA receptor. When magnesium is present, it blocks that receptor, essentially standing at the door, preventing it from constantly firing and transmitting pain signals.
Right, keeping the peace.
But if your body is deficient in magnesium, that bouncer just leaves the door unattended.
And the pain signals just rush right in.
The gates open, calcium rushes into the cells, and the neurons start misfiring wildly. This creates a literal wave of electrical disruption across the entire brain.
Oh, wow.
Yeah, blood vessels constrict, and then they dilate improperly, releasing all these inflammatory chemicals. It's essentially a rolling blackout of your neurological grid, and that whole cascade is what we experience as a migraine.
So if you are deficient, getting more magnesium, basically restaffing that electrical grid with bouncers, may help stop those misfires from happening in the first place,
Yeah.
reducing the frequency of the attacks.
Yes. And this isn't just some alternative theory. This is where we see the most concrete institutional backing in the data we are examining today.
Right, because the literature points out that the American Headache Society explicitly recommends a specific preventative dose. They suggest 400 to 500 milligrams a day of magnesium oxide supplements.
That's right.
That feels like a massive leap from where we started today. We went from, hey, maybe rub some lavender on your lip, to a major medical body giving us a highly specific milligram dosage of a specific compound. Considering they're giving a very specific number, is this the closest thing we have to a prescription-level endorsement among these natural options?
Without a doubt, yes. When an organization like the American Headache Society assigns a numerical dosage to a naturally occurring mineral, it really highlights the sheer weight of the clinical data behind it, but the specifics really matter here. You mentioned they recommend magnesium oxide.
Right. Why oxide specifically? Because if I go to the pharmacy right now, there's magnesium citrate, glycinate, just a whole shelf of different ones.
Magnesium oxide is frequently utilized in these clinical studies
Yeah.
because it contains a very high amount of elemental magnesium per pill. That makes it a lot easier to reach that 400 to 500 milligram threshold without having to take a giant handful of capsules every morning.
Okay, that makes practical sense.
It does. However, oxide is also notoriously poorly absorbed by the digestive tract compared to other forms.
Oh.
Yeah, which means it often draws water into the intestines.
Meaning it causes massive digestive upset.
Precisely. It can cause severe cramping and diarrhea. Which brings us to the most critical point of this entire segment. You cannot simply hear that the American Headache Society recommends 500 milligrams and go order a giant bottle online.
Because it's an internal regulator. It affects your heart rhythm and your blood pressure.
It does. Taking high doses of magnesium, especially if you have compromised kidney function or are on certain medications like antibiotics or diuretics, can be genuinely dangerous.
You really can't mess around with it.
Not at all. The absolute necessity here is that you must consult your healthcare provider to actually test for a deficiency, choose the right type of magnesium for your digestive system, and determine a dosage that is safe for your specific biology.
So what does this all mean for you, the listener? Let's take a step back and look at the terrain we've covered today. We started by looking at the somewhat contradictory but highly accessible promise of lavender oil, utilizing the olfactory nerve to send a rapid calming signal directly to the brain's emotional center.
Which is a great tool to have.
For sure. Then we moved to the undeniable dual-action power of ginger, using internal chemistry to restart a stalled digestive tract and fight nausea. From there, we looked at the physical disruption of acupressure, attempting to close the neurological pain gates by flooding the system with fast physical touch.
And finally, the foundational regulation.
Exactly. The foundational regulation of magnesium, realizing that sometimes a migraine is simply a sign that your body's cellular bouncer has left the building.
It is a very comprehensive look at how multifaceted migraine management can truly be. And I will gently remind you, the listener, one last time, the most vital step you can take today is bringing this information straight to your doctor.
Don't DIY this.
Please don't. Do not try to assemble this management strategy in the dark. Let your healthcare provider help you build a personalized, totally safe routine.
It really is about taking back control. Looking at all this data leaves you with a pretty wild thought to mull over. We've seen today how a complex, debilitating neurological storm can be influenced by seemingly simple interventions like correcting a basic mineral deficiency or stimulating a specific nerve pathway in the wrist.
It's incredible how interconnected it all is.
Right. If our migraines can be influenced by such a wide variety of triggers, a scent we inhale, a root we digest, a physical point we press, and a mineral running through our veins, what does that tell us about how wonderfully complex and interconnected the human nervous system really is?
It's not just a headache, it's a full-body conversation.
It makes you wonder how many other chronic, supposedly incurable conditions are simply our bodies waiting for us to find the right physical or chemical password.
That is a truly fascinating perspective to leave on.
Thanks for joining us today, and until next time, keep asking questions and keep exploring.